All right, so let's start with eupnea, or normal, which I don't believe I've ever heard respirations described with that term. Usually a respiratory rate that's normal is described as their rate is normal, which is usually about 12 to 20 breaths per minute. Tachypnea, which is a fast or rapid rate of breathing, can also be described as shallow. Now this rate is greater than 25 breaths per minute. Now bradyapnea, which is a slow rate of breathing, usually below 10 breaths per minute. Now dyspnea, which is difficult or labored breathing, also known as shortness of breath. Orthopnea, which is shortness of breath or dyspnea that occurs when lying flat or causing patients to sleep in a high phallus, which is a up position, or propped up in a bed or a chair, or even a recliner. Now apnea, or without breathing, is defined as the cessation or stoppage of airflow for at least 10 seconds, and this is described by the American Academy of Sleep Medicine. On a side note, you have probably heard of something called sleep apnea, which is the intermittent cessation of breathing while sleeping. Cheyne-Stokes. Cheyne-Stokes respiration is an abnormal breathing pattern, usually characterized by progressively deeper and sometimes even faster breathing, followed by a gradual decrease that results in a temporary stop in breathing, like apnea, for example. The pattern repeats, with each cycle usually taking 30 seconds to 2 minutes. Also, Kussmaul breathing. This is characterized by a deep, rapid breathing pattern. It is typically an indication that the body or organs have become too acidic, and it's an attempt to expel carbon dioxide, which is an acidic compound in the blood in the body. Bios respiration is an abnormal breathing pattern characterized by groups of regular deep inspirations, followed by regular or irregular periods of apnea. It is actually named for a lady named Camille Biot, who first characterized it in 1876. Now, agonal breathing. Agonal breathing is often present when the body makes final attempts to recover itself. This is a primal reflex that occurs as the patient is dying.
Inspirations are the number of breaths, usually 12 to 20, that a person breathes in 1 minute. One inspiration, one expiration is the exchange of carbon dioxide and oxygen.